Hello, good afternoon. Let's go through some data and then take some questions. No new deaths over the last 24 hours. Still at 207 neighbors we've lost during the pandemic. Looking at testing, 1,370 tests back since yesterday. Our 7-day rolling average for positive cases is 1.1%. Our 3-day rolling average is 0.91%. Early indications are tomorrow might be a little bit of a better day for positives as well, so hopefully we'll see that. Hospitalizations, we have 19 individuals and neighbors in the hospital, 5 in the ICU, so let's please keep them in our thoughts and prayers. Out of those in the hospital, 12 Caucasian, 5 African American, and 2 Asian. Looking at cases, we've now had 4,791 positive cases since March 16th. That's 26 new cases. When we look at the 26, what does it tell us? We had 2 travel-related cases, 6 household contacts, 3 senior facilities, those are staff, and 14 community spread, of which we know the source of 6 of those cases. So overall, the trend has been we've seen more household contacts. That's because we had an uptick in cases for a 2-week period of time. So it looks like it's starting to come down a little bit. The positive of a household contact is these are individuals who are in a quarantine. So when you think about the idea of contact tracing and getting to the source of the spread, we've already isolated that. So that's the positive there. Still seeing some basic trends related to individuals who are going to work sick, or they are going to school sick, or extracurricular activities sick. And I was having a conversation with somebody I know, and they said, we were talking about a case where we knew the individual, and he referenced that, well, he just had a sore throat. It wasn't like he went to work sick. Well, if you have a sore throat, you are going to work sick. So that's what it's like in COVID-19 time, especially as we get into the flu season here. We just need everybody to hunker down. The COVID tests are turning around very quickly, 24, 36-hour period of time. And so we really need people to get the test. We've all learned how to work remotely to a degree. And again, most employers are going to work with us. If they're not, you can let our office know. I'm happy to reach out to employers who are giving you a hard time because you don't want to potentially spread any virus to your colleagues. Looking at background on cases, who's been impacted since March 16th, 2,714 are female, 2,077 are male, 557 under 19, 1,055 in their 20s, 629 in their 30s, 575 in their 40s, 671 in their 50s, 508 in their 60s, 342 in their 70s, 286 in their 80s, and 168 in their 90s. Again, school-based testing at MBT Bank Stadium, 2 types of tests. Saliva test. You need to register with Upstate. You can either register by calling 315-464-2582, option 4, or you can create a MyChart. At Upstate, MyChart is essentially you register your own information. It's your own personal health page, mychart.upstate.edu. If you have one already, it's just use that one, but if not, you can create one. And that allows you to set up an appointment. Again, that's for the saliva test. We recognize that it may take you a little bit longer to get in and get a saliva test. And if you want to just get a nasal test and your child is symptomatic, you're a teacher, you're symptomatic, you can pre-register at register.cayugahealth.com, or you can show up and then give the information to register, and you can get a nasal swab right there at MBT Bank Stadium as well. Again, we have capacity for 200 a day with that. We have not been meeting capacity, so that's a quick way to quickly get there and get a nasal swab test done. as well. There's other testing sites, Syracuse Community Health Center, Crouse, Water Street at Upstate, St. Joe's. Your doctor's office may have testing. There's lots of testing going on in the community. Speaking of testing, asymptomatic testing, our saliva pool testing in schools began at the end of last week. Today we were at ESM School District. We've seen some cases at ESM. We want to go and see if we can uncover anything from asymptomatic. Tomorrow we will be at Lafayette, and then later in the week at Liverpool, West Hill, and the City School District. So we're doing our asymptomatic pool testing right now as ways to try to figure out and find hidden pockets of the virus. Looking at another great partner, Syracuse University, we had a cluster there. It came from a party. Once you have a cluster, you're going to see steady days of cases. We saw that. Now that cluster has been really wrapped around, and we saw a couple days where we had no cases on SU's campus. They had a lot of testing done last week. This week is their regularly scheduled campus-wide testing, so there will be over 16,000 tests at Syracuse University this week. So again, we want to thank the Chancellor, the Vice Chancellor Haney, and their team for this proactive testing, which has helped us. And there's no coincidence that once you get over a cluster, your data starts to drop. We were at 40 a couple times. I think we might have even been at 50 cases last week. Now we're back in our 20s once the cluster goes away. And hopefully the behavior we have today, hopefully folks are taking a little bit more serious. If you're sick, stay home, get a test. If we all start doing that now for the next 2-3 weeks, hopefully 2-3 weeks from now, our data will be even stronger. Looking at that, Thursday we're going to really look into what we're seeing for hospitalizations now. We'll give you some data on that. We've had a little bit, we got down to about 9-10 hospital numbers in the community, really, really low numbers. That's the lowest we had since March. A little bit of an uptick. What the trend is we've seen is over the weekends it's harder to discharge patients. Hopefully tomorrow and Wednesday we'll discharge some of these folks. But certainly there's new folks coming in and out of the hospital. So what are the trends? What are we seeing? And what are the trends with college students? Are we seeing any college students being hospitalized? Any other students being hospitalized? We'll have that information on Thursday to review. And so that's important. Again, a reminder, everybody please get your flu shot so that we can avoid potentially a busy flu season. Right now things look strong related to flu that we've seen in our community, not much of it. And in the Southern Hemisphere, it's been a light flu season. Certainly we could use that. One way to ensure that that happens is if everybody gets their flu shot. So please do that as well. Saying that, happy to take questions on topic or off topic. Yeah, I think there's a little bit of COVID fatigue going on. Right now, I think we're certainly changing our messaging, right, and talking about what we're seeing. We had a cluster, so there's no way to, when you look at that, we had over 100 cases over a 2-week period from one source, so that's going to move your numbers. And then even once you wrap your arms around that, remember you're quarantining a bunch of students there as well. So some of those students become positive, and those become household contacts essentially. So that's kind of beyond us. So that drove our data. We've seen a couple 3 days of better data related to the number of cases. We're doing a lot of testing, so our positive rate is still 1.1, and over the last 3 days it's been going down. Hopefully that will continue tomorrow. But there's certainly, when you look at it, every year people, myself included, people get kind of sick or run down certain times a year. You think it's normal, it's just my allergies, it's just, just this, it's just a little sore throat, no big deal. The virus impacts each one of us a little differently. So what we're saying is we can't have fatigue now. We need to really hunker down. We need to go get a test, and there's areas to get a test and get them done quickly. so that you can rule out COVID and get on with your daily lives. And if we do that, we'll see our cases stay low right now, because at some point we'll have more pressure on us when we're all indoors again. And so we have to manage the virus a little bit stronger then. And so we want to get to the point where our caseloads are down going into that process, and then hopefully shortly after that we have a vaccine that gets approved, and then it's a matter of getting the vaccine out to the community at large. So I think we're in the third quarter, and with this process, and now is not the time to really get too fatigued with this. I know it's tough, and we're all sick of dealing with this. We're sick of a lot of the parts of this process, but we've done well. I think we can do really well going into to the winter time here as well if we just stick to the basics. Correct. Correct. Cool. Yeah, I know that that's still a trend. Normally, if there's a specific larger cluster, Dr. Gupta will fill us in on more information. But we ask her each day when we get the numbers, what are you seeing from a macro level? And she'll tell us we're seeing the same things, which means to us that people are going to get sick, right? It's when we start to get sick, we need to rule out COVID right away, and we know how the challenges that this virus can present. So I think that's the challenge, is we just need to change our mindset a little bit. We're going to get sick. Now we're going to have to rule out COVID, and most of the times it won't be COVID. So we're seeing those cases where it is COVID. Folks are going into work. They're going out to eat. They're socializing, and then our quarantines then are large, and then people get frustrated with how we have to quarantine, and so. But that's what happens with this, is that more active COVID cases lead to larger quarantines of individuals.
In terms of a vaccine, Ryan, what do you think of what you've seen so far from Governor Cuomo's plan for rolling it out? And is the county working with the state to try to make those plans?
I imagine we will, Tim. I don't know how we could really roll that out without running it through our emergency management and our health department. I think from what I saw, the way the vaccine will be distributed seems sound, and I think hopefully we have some success with a approved vaccine in 2020, so that our the first responders and our most vulnerable can get that vaccine as quickly as possible, and then you're spending Q1 of 2021 trying to get the rest of the public vaccinated so that Q2 you can enjoy the fruits of our labor again. So that's something that I think the plan looks pretty good. I know the CDC planning for rolling out the vaccine includes local health departments, and I think there'll probably be a lot of overlap between the governor's plan and what the CDC is recommending.
On a different topic, do you have any thoughts on when we might be able to see spectators in the Carrier Dome, either just students or some number, and are you talking to the state about that? Yeah,
we are talking to the state. I think one idea would be, and again, right when we were making this pitch, we got a cluster from a party, right? So if you want to look at consequences for some of our students, we were trying to get students into the dome to watch football. So now I think we're through that. So if we get a good 16,000 tests this week, I think we have a very good positive rate there. I think I have enough of a case to then go back and say, can we try to get some students in the dome? We can arrange to have those students tested the Friday before the Saturday or the Thursday before the Saturday, so that we know that they are negative, and therefore with other risk mitigation things you can do, I think we can make a sound case. But certainly because of the party, which triggered hundreds or so cases, we lost that argument for a period of time. So if we can get back to a point where we're not seeing lots of cases anymore, which it's slowed down now, we're through that. hopefully if we can sustain this, then we have a stronger argument to make to the state.
Would you hope maybe for the beginning of basketball season?
Yeah, well, hopefully you can get some. If we do well, there's still some home football games left. Hopefully, maybe there, but certainly basketball as well. I know Coach Babers and Boeheim would love to see some students in the brand new facility, and eventually, once you get a vaccine, depending on the timing of that, maybe there's a way you can bring in some capacity as well. I think there's ways to do it, but unfortunately, the timing of us maybe getting the state to really get excited about diving into the plan, then we had cases. So then we got to get our arms around the cluster, and now we're almost at the point where if we get through the week of testing, numbers look really, really strong. I think we have a good argument.
Would it make sense to have it students only at first?
I think so. I think because we can essentially guarantee that the students are being tested. You start out with testing the spectators, then you can 2 weeks later see if anything happened. Then if it didn't, I think you have a model that you can really look at for the public at large. And there are, as we've seen with the rapid tests that Abbott came out with, there's other low-price rapid testing coming out. Maybe those are ways to open up your economy in different ways. I think certainly once you have a vaccine, easier to open up your economy using that as well.
And last one, not to drag it on forever, but have you thought about a number of people to start with that might be allowed in?
Yeah, I think the number we were talking about with the university was between 3,000 to 5,000 students, and you would have the students sitting by where they live. So you would have them distanced. You would have them, if Ernie Davis Hall sits in one section, distanced. Why would that make sense? Because they already live together. If there was already some sort of spread, they're already in a situation where they would be at risk. So you would do it that way. Obviously, the capacity at the Dome being 50,000 people, very easily, new ventilation systems, certainly something that could be done. But I think we saw some movement this week. We saw movie theaters open up with some restrictions, and then you saw getting ahead of skiing season, which is important for upstate New York. So I think we're seeing the point where as the vaccine gets closer, we got to start thinking about these other segments of our economy. How can we do it? Can we get a little bit of a head start? Other questions?
I'll ask another one.
Yeah.
You guys keep a cumulative data set of the age range of people who get infected. Would it be possible for us to get that on a daily or a weekly basis, just so that people could maybe better understand how many cases over the short term are occurring in public schools, how many look to be college age?
Yeah, I think we're going to be releasing tomorrow a school list of, every day, of the cases that happen per school, total cases per school, so everybody can see what I see every day. We can look to do that too. I think we do that with age, but if we don't, we could look to do that. But yeah, we specifically watch the under 19 breakdown, right? So we want, and Tim, if you look at it, your elementary age 5 to 9. We've had 62 cases out of the 4791. Your 10 to 14, we've had 71 out of the 4791. Your 0 to 4, most of these being household contacts, the little ones with mom or dad, 76 out of the 4791. So you're under 19. When I say we have 557, where do they come in? Our 15 to 19-year-old demographic, 348 out of the 557. So we've been seeing that consistently. The other numbers have ticked up a little bit since school started, for sure. But we're really watching the data on schools We quarantined very conservatively in the beginning so that we could study to see how many quarantine cases became real cases, and that then as we learn more about it, then we'll probably change the strategy moving forward if it merits. But right now, it seems that we have kids who get the virus. It seems that it's the extracurricular activities that drive it, or it's driven from outside of school rather than being transmitted in school. We're really studying that. That doesn't.
How do you know that just from contact tracing?
Yeah, yeah. There may be a couple cases that certainly looks like contacts related to in school, but from most of the contact tracing, it's going into the building, not necessarily spreading within the building right now. Other questions?
You mentioned the flu. Has the county recorded some flu already?
There was very little flu, according to when I was talking to Upstate the other day. We're looking at getting the numbers there. You know, it's the perfect time to get your flu shot. Dr. Gupta tells me this. So, you know, you don't want to get it too early, or else it might not last the whole season. But mid-October, good time. Please, a lot of our private sector partners, whether it's Walgreens or CVS and Wegmans, are all doing it. So please get your flu shot.
Have you made any more decisions about county layoffs or furloughs for the rest of the year?
Yeah, Tim, I think we're going to wait till we got a sales tax payment in November, but we're looking pretty strong at not having to make any more workforce adjustments in 2020. So unless something really draconian happens, I think that pain in this process is gone, and now we're looking at finalizing our 2021 budget, which certainly will be another set of challenges in this process. So again, our budget will present to the legislature on November 4th, the day after November 3rd, which is an election. Other questions? Okay, folks, thank you, and we'll see everybody on Thursday.